Obviously, in Manitoba, they've had big concerns about the rising case count. As of Sunday, 494 cases there. Alberta, pretty close to 1,000 cases, which has become the norm in Ontario and Quebec. Let's get some more perspective. Dr. Abdu Sharkawy is an infectious disease specialist at University Health Network and has joined us in CTV News throughout this pandemic to try to put some context around the cases and what has been your case. I mean, you were one of the early voices to talk about the need to take things seriously, and here we are heading into the fall with many pockets of the country seeing their highest case counts since COVID-19 began, basically. What's been your reaction?
Well, clearly it's disappointing. We had foreseen this scenario arising many months ago. It's unfortunate that we have arrived where we are, but it's not surprising given the fact that this is a virus that spreads through close human contact. And unfortunately, it preys on us when we are not vigilant and when we are unsuspecting. And we have taken some liberties with respect to easing of our restrictions, getting back to habits of socializing and private gatherings that have really done nothing but undermine all of the efforts that we put forth in the spring. And we're in a situation now where we're looking at the possibility of things being even worse than they were in the spring, because we just have a pool of far greater susceptible numbers of people than we did in the spring when we were in a very restrictive mode. So we've got to take this much more seriously across the board. We need real help from our policymakers from all levels of government to provide tangible financial relief and support to help people stay home and be paid for staying at home, to keep businesses sustainably alive, and so that we can remain safe and get through this. The approach that we're taking right now is not going to work. It is clearly failing, and I think it's going to lead us down a path of much, much more harm for a longer period of time.
And when you talk about that financial aid, and it's interesting, I mean, you're a medical professional, but you've been asked that question many times because this is where the tension is created. People need to work. They need to run their business. There have been restrictions on that, and it creates challenges for them. But you're saying if we want to keep the case counts down or under some kind of control, then we have to see, a return to some of the emergency-style aid programs that we saw from high levels of government, such as what was rolled out early on during the pandemic?
Absolutely. And we may have to go further than that, and you're always going to have critics who are saying, who's going to pay for this? How much debt are we going to pay? Well, how many lives can be cost? And what's our debt going to be when this pandemic rages completely out of control and our healthcare system's capacity is pushed beyond the brink of collapse? And then we're forced into measures that are even more restrictive for a longer period of time. I think that is something we really have to grapple with right now. I've talked to countless small business owners in the past couple of weeks. I empathize greatly with what they're going through. I recognize the social and emotional and mental strain that this is taking its toll on in terms of themselves and their families. I want to help them. I think we all need to help each other right now. But I can tell you, bar none, that operating at 30%, 50%, even a 70% capacity in most businesses is not tenable. That's not something that's going to work. It's a slow death for all of these hardworking people that our elected officials ostensibly want to help. We need them to survive and to get through this at 100% health capacity, just like we need our healthcare system to function at a better capacity. So we've got to take those steps right now to provide them with meaningful support right now. Keep them at home, allow them to shut their business operations down so that they can survive when we open things up again with our numbers being low, as close to zero as possible. And I guarantee that's going to be a more profitable, a more sustainable solution for everyone than the road we're on right now.
Well, speaking of solutions, you've already seen the headlines this morning. You have one of these key vaccine hopefuls, the company Moderna, coming out talking about a near 95% effective rate in the trial they've been doing. Pfizer had come out literally a week ago, talked about essentially a sort of a 90% effective rate. These are not necessarily apples to apples, slight differences, but there is optimism in the air. There's undoubtedly people looking at these developments and feeling encouraged. What was your reaction?
I'm very excited. I mean, obviously, any additional sources of support at getting this virus under control and eventually seeing it to its, finality is something that's going to evoke a great deal of optimism and hope, including here in the medical community. What's promising here is it's a different vaccine, it's a different mechanism, it has different storage requirements, so it's going to have, more logistical benefits in terms of being rolled out than some of the other vaccines that are available or will be available. It's another tool in our tool shed for dealing with this. But we've got to remember that we're still months away from this being accessible to most people. And in that time, a lot of damage can be done by this virus. And it's up to us to make sure that we are responsible at all levels of our community and get the support that we need from our elected officials to enact the public health measures that will get us to that bridge to safety. We're a long way from that yet.
And Dr. Sharkawy, I'm certainly not going to position you as the expert on approval times at Health Canada, but since so many people right now are talking about Moderna in the United States having success with this vaccine trial and what the U.S. FDA will do, it bears repeating that there are no vaccines currently authorized for the prevention of COVID-19 in this country. We know Health Canada will be monitoring everything very closely. Are there any things to think about, just Canada versus the U.S., when it comes to getting approvals, in your opinion, of these vaccines?
No, I don't think Health Canada is going to principally change their approach, and I think that that's important. We need to balance the urgency of the situation with maintaining, absolute certainty that whatever is going to be accessible to the public at large is without a doubt safe. That's not something that should ever be compromised. Heaven forbid we're in a situation where we miss an important safety signal that would undermine public confidence in our ability to provide necessary and important vaccines throughout our community in general. And that's something that I think we don't want to have happen. I'm sure that Health Canada will do its due diligence and provide the necessary approval when they can. I'm hopeful that that will be in a timely fashion.
And real quickly, before we let you go, Dr. Sharkawy, people are hearing about Moderna this morning. They heard about what Pfizer was working on last week. There are many others that are working to get to the finish line of COVID-19 vaccines. If you're an individual, and let's say over the next 3 to 8 months, there's an opportunity for you to possibly take one of these vaccines. As a medical professional, how are you going to feel like that? Because there's obviously, we were just talking in our last segment, there's not enough vaccines to go around for everybody in the world right now. And at a certain point, I imagine we're going to be having a conversation about, which vaccine do I as an individual have access to? What do you think your medical answer to that will ultimately be?
Well, there's still a lot of unknowns, but one thing I think that is quite certain is that general access to these vaccines will not likely be available before sometime in the summer or perhaps even early fall. And the reason for that is there's going to be a lot of higher risk targeted populations that are going to be needing the vaccine first. And that's going to include the elderly and immune compromised, as well as people who work in public facing jobs and frontline healthcare workers such as myself. So, if anything, maybe we're going to be the guinea pigs, if I can use that term very loosely, before the general public sees these vaccines. I'm hopeful that there won't be any unexpected safety signals that are recognized once those target populations have the vaccine administered, and hopefully that will give the public extra confidence that it's something that is going to be a viable option and will get good uptake across our communities.
Dr. Sharkawy, thanks for your time this morning on this breaking news. That's Abdu Sharkawy, who is an infectious disease specialist and has been helping us throughout this pandemic.